All right. Well, hello, everybody, and welcome to the Zoom. After all this technology difficulties, we are finally just on Zoom here. And quickly, since we are late, I just want to tell you that I'm super excited to have a special guest today. And this is Dr. Georgia Balsley. She is a naturopath, and I'm going to let her introduce herself and tell us a little bit about what she does. But we're here specifically to talk about menopause because a lot of women are in the dark, completely in the dark about what's going on with their bodies. They haven't been prepared. There's like very little education, not only for them, but for the spouses, the partners. And then, we want to just, this is like an informative call with a person that deals with this in her office. So I'm gonna let Dr. Georgia introduce herself and, let us know about what she does. And then we'll get into the chat.
Thank you.
Joining me.
Thank you, Patricia. I'm honored to be here and honored that you asked me to speak. And yeah, we had some technical difficulties for Thursday, didn't we? But we made it happen. And I said those people who need to listen needed to have it later. That's okay. So we'll get it out to everyone. But my background is a traditional naturopathic doctor. I work in a functional facility with a MD. And we see patients from all over the country, specializing in getting to the root of things. The doc I work with, her specialty is OBGYN, and she actually finished out in wound care. So we deal a lot with hormones and hormone changes in our office. I got involved in naturopathic medicine actually through my children, and it's so resonated where I felt I needed to be. So this is where I am, helping transforming lives.
Wonderful. Thank you so much for sharing that. And I am thrilled to have you. So let's get started, right? So
Sure.
Can you tell us what menopause is and what are the different stages of menopause? So I see a lot of women asking like, what stage am I in? I have no idea. I'm feeling this and this and this. So like, can somebody tell me like, when does it start really? So if you can go over that to kind of, start the conversation, that would be awesome.
Sure. Well, menopause is a word that we hear when, technically, I think when we start having children, right? We don't hear it in our teen years. Maybe we might hear some of our moms or our grandmothers talk about menopause, but overall, we don't become more familiar with it till we get closer to that and start having symptoms. But menopause is a completely normal condition that takes place in all women. So nobody escapes menopause. But it's signaled by having 12 months of non-cycling after your last menstruation. So let's say let's say this month was you had a cycle, we would start counting from that last cycle, and that after 12 consecutive months you've not had a cycle at all, you've been considered that you've gone into menopause.
Mm-hmm. Okay.
And you're right, there are different stages of menopause. So there's actually 3 stages. We only kind of think about 2, right? We think about perimenopause and we think about menopause, but there's also postmenopause. And so perimenopause is when the body usually starts beginning its transition, and that's usually happens between ages 40. It starts really in the ages 40, but sometimes it's now happening to women in their 30s. My take on that is because we're more exposed to a lot of hormones in our diet, and I think that's creating the earlier shift. But perimenopause generally starts in our 40s. And then you have menopause, and you move from perimenopause into menopause, and like I said, that's when you've experienced 12 months of consecutive or without a menstrual cycle at all for 12 consecutive months. And then postmenopause is generally, you're considered postmenopause when you've gone 24 to 36 months without a cycle at all. And usually by that, you start seeing the symptoms of perimenopause and menopause subside.
Okay. And can you talk a little bit about the most common symptoms that you see, with menopause and, the different stages, I guess?
Yes. We dread menopause because we the first thing we hear about is all the women that suffer with hot flashes. And so that's really one of the most common, night sweats, irritability, memory lapses. So, we get really hard on ourselves, but estrogen plays a huge role in our cognitive function. Mood swings, our hair starts thinning, or you start losing some hair. Um, you A lot of women will explain abdominal bloating, that they start seeing not only
Mm.
weight gain, but they'll start feeling more bloated. You start seeing some insomnia and some sleep issues, headaches, digestive issues. And unfortunately, this is the time where anxiety and depression can kick in.
Wow, that's a lot.
It is a lot. And you know what? Those are, unfortunately, the most common. There are other things that go along with it. So when we think about menopause, we think, oh, Lord, we're going to take on all these other things. But the good news is we don't have to.
Yes, yes, and we'll talk a little bit about that later. So you mentioned a little bit about hormones. Obviously, this is like a hormonal imbalance, right? Because the hormones are, fluctuating and everything. So can you tell us a little bit about, like, the female hormones, and how, what kind of hormones do women have, and how do they change during menopause to affect us,
Absolutely.
in all these ways?
Absolutely. Well, we have three different types of hormones. We have estrogen, and we have three different types of estrogen. We have estrogen, estrone, and estradiol. And then we also have progesterone and testosterone. So men also have estrogen. They have progesterone and testosterone as well, but it's just in different levels. And what ends up happening is, we go through adolescence and then move into puberty, where our body is getting ready to start getting ready for reproduction, because really that's what it's all about, right? Mother Nature, we're a living organism, and that's what Mother Nature cares about, is that we reproduce. It's
Mm-hmm.
just unfortunate that after we do that, we're done. But we're the only living beings that really fight that aging process, because we want to remain as vital and healthy as we can on the flip side of reproduction. So those hormones are really crucial for the reproductive factor. And most of those hormones, in the bulk of them, are actually made in the ovaries. And the ovaries are responsible for stimulating that estrogen. And estrogen is responsible for not only our cognitive function and protecting our brain and our heart, but it maintains our skin, our vaginal moisture, and elasticity. And so when those start shifting, we start seeing changes there. And progesterone is primarily designed for gestation. So it's the progestation hormone, and it increases when an egg is fertilized to help maintain a pregnancy. And then you have testosterone, and us women do have testosterone, some of us a
Yes.
little bit more than others. And testosterone is really important for helping our bone growth and our strength of our bones, but it also plays a little role with estrogen in our libido as well. So when we start hitting perimenopause especially, we start seeing starting that decline of estrogen and testosterone, and a lot of the women there start, making comments about their intimate life, saying that definitely has changed. No desire, no motivation, nothing, and
Mm-hmm.
that's because those hormones have shifted.
Mm-hmm. And it's probably all the other, like, like you were saying, the depression, the anxiety, that kind of also probably affects,
Oh, absolutely.
everything the rest of your life, right?
Right. And
Um,
if you're not sleeping well, you're tired. Who wants to engage, right? Where's the energy? So,
exactly. And if you're feeling bloated and you get weight and all that, I was like nodding my head. I'm like, yeah, yeah, all that, when you were saying all those things. So, um, again, back to the education part, like, women are, I'm really, and I include myself, I didn't really know what to expect, right? So how can we prepare, like, what do you tell your patients, or, like, younger women that you see, is there any kind of, like, preparation, education, we should be talking more, I think.
that really is important, because you can shift a lot of these symptoms by really addressing your health, and diet. Diet does play a crucial
Hmm.
role. We have a tendency to eat a high refined diet, so we eat a lot of processed foods, a lot of sugars, which stimulate the adrenal glands, and create a lot of issues. So things like caffeine intake. If you're already starting to experience hot flashes, caffeine is one of the worst enemies of hot flashes because it'll exacerbate hot flashes and make them last longer and be stronger. And so we want to tell them to prepare. So, some of the things you definitely want to do is, focus on your health. Are you exercising? Can you do things to help with stress reduction? How is your sleep? What can we do to help enhance sleep? Those type of things, and also looking at diet.
Right. Yeah. Definitely lifestyle is going to play a role in the severity of the symptoms, right? I mean, if you're
Very
in a
much.
place, yeah, if you're in a place of health, it's going to be a little bit easier maybe than, and everybody's different, like people, and also it depends on like other underlying health conditions, I imagine, right? If you have other things that
Yeah.
exacerbate, the hormonal changes and all that, and that's gonna also be a factor, right?
Yes, very much so. Conditions such as maybe even high blood pressure, diabetes can affect it as well. When we think of diabetes and insulin, insulin's a hormone.
Right. Yeah, there you go.
Mm.
Okay, great. I in my page, and we are, well, I didn't mention this at the beginning, but Dr. Georgia and I are partnered with the same mental wellness company. And our company focuses on gut health a lot for overall health and mental wellness. So can you tell a bit about how the health of your gut affects this time of our lives, and how it influences how we feel, the symptoms and the hormones and all that stuff.
Absolutely. Well, the gut is I call it in our office, it's the beginning of everything. So if we don't take care of our gut, other things can't function well, such as our heart, our liver, our intestinal tract, our brain. All of those are interconnected. So the gut is the beginning. And the other thing that's really interesting is that we have all this microbiota in our gut that does different functions. But when we don't treat our gut right by the lifestyle, the health, the foods that we eat, and we're not really addressing the gut, we can create hormonal shifts as well, because the biota that's there can actually affect estrogen and our estrogen levels and the estrogen conversion. So the healthier the gut is, the better you are at going through menopause, because you don't have these fluxes.
Right.
That's where a lot of the symptomology comes from, is the hormonal fluxes.
Right, exactly. And we were, before we got kind of like started, we were talking about hormone replacement a little bit. Can you go over that? Because there's also all these like misconceptions, and you see and hear different things about hormone replacement is bad. You can get cancer from it, and a lot of people know there's no risk. Hey, Patty, how are you? And Melissa. Can you talk a little bit about that? Because again, the education and the, different people talking about different things depending on how you approach the menopause. Talk a little bit about the hormone replacement, and, if you actually need it, and go into that topic a little bit.
So, Patty, remember when I told you that Mother Nature doesn't care? Once we've done our reproductive purpose,
We're done.
Mother Nature doesn't care anymore. We're done. On to the next one. And, but we still have, let's say we have another 50 years left. We'll just use a lifespan of 100 years. We have another 50 years left. We want those 50 years to be as healthy and as vital as possible. And hormones do play a huge place in that. And hormone replacement therapy, it can be a very positive aspect to that, but it's the type of hormone therapy that you choose, which is really important, and understanding that fact. So in our office, we do suggest to many of our patients hormone replacement therapy. We use bioidentical hormones. I'm personally on hormone therapy. It's not because I went through menopause and I had any symptoms. I was one of the fortunate ones, had a blood test, and the doctor said, "Hey, do you know that you're like through menopause?" And I'm like, "What?"
Wow,
I'm
how
just kind of
lucky.
like, "Woohoo," right?
That's
So I
amazing.
didn't, yeah, yeah. Wouldn't we all like to find out that way, right? And so, I'm really fortunate, but I have sisters who suffer. I've seen my mother, I've seen friends, and it can take quite a toll. And it takes not a toll on your body, but your physical mind, and it can take a toll on your relationships. And so,
Mhm.
we want to be able to feel ourselves again. And those hormones, when they start shifting, really puts us out of sync. And so in our office, we address hormone therapy through bioidentical hormones and give the risk factors of what that is. You know, the flip side of it, why would I take it if I didn't have any symptoms? Because estrogen affects cognitive function as well. It affects my bones, it affects my skin, and I just kind of like, I enjoy those things, so I want to keep them as healthy and vital as possible. But in
Mhm.
the same process, if I just took a hormone replacement and I didn't address other things like my lifestyle and my gut, especially because that's the point in everything that we do, it's the beginning of all disease. I'm kind of throwing I'm just throwing my therapy kind of to the wayside, right? So I want the best of both worlds, because the bottom line is I can do hormone therapy, but the hormone therapy doesn't replace those neurotransmitters in my gut that greatly affect my brain. And so I want to be able to have a full functioning brain at 100. And I believe that we can, and beyond.
Mhm. I'm glad that you mentioned that because I think a lot of times people think of hormone replacement therapy as a kind of like a magic solution.
Yes,
And, you know, then they're like, well, I was in HRT for like a year and then now it's not working anymore. But we all also have to examine how we're living our lives, right? So like you were saying, I mean, health, stress, sleep, diet. I mean, diet, you know, we're learning that it's affecting so many things like, you know, other things like Parkinson's are being tied to diet. So, I mean, you know, I think we have to examine like our entire life and how we're living, right? Because
absolutely.
the hormone is not going to be a cure for all the symptoms that you have, your weight gain and all those other things, and your memory,
Correct.
and, you know, like you were saying, and the hot flashes, our favorite.
Yeah.
um, so, so then in your practice, you do recommend like some kind like the bioidentical. That's kind of like your what you use for your patients in your practice.
We do. The clinical studies has shown women over the age of 60, we explain to them that the risk the first year of hormone therapy could be the risk of a heart attack or breast cancer. And the reason being is because estrogen helps soften things, keep things elastic, right? Because we talked about vaginal tissues and our skin and how that keeps that pliable. It does the same thing with inside our body. And so if you have arterial plaque buildup, you could release a little bit of that, which could cause a heart attack or a stroke. Or if you have an undiagnosed cancer, you know, adding estrogen could exacerbate that. But
Mm-hmm.
after the first year, the side effects go, the negative side effects go way down
Mm-hmm.
after the first year. And so we educate our patients, sorry, on why that they would want to use this, and we give them a booklet to read, and we want them to be fully understood with questions and open about what they're trying to do. You know, we're not encouraging an off-brand things like Permarin, because, you know, what do I have in common with pregnant horse urine? To really affect my body and then create the change. But we also talk about the lifestyle and diet changes and sleep. How are you sleeping? How are you managing your stress? And really, what does your gut look like, because of the fact that we know the flora does affect how estrogens function.
Mm-hmm.
And we want real good seeding in there, because not only does it affect the estrogens, it affects your immune system. 70% of your immune system is your gut. You know, we talked about going through depression and anxiety at the beginning of your hormone change, starting in perimenopause, you know, and having those neurotransmitters to protect the brain from those issues as well. So we are a full spectrum when we talk to our patients, and offer both. Many patients don't choose hormone replacement therapy in that aspect, and that's okay. But I think that we do a great disservice if we don't tell them that it's available and why, and let them make that decision.
Right, right. I mean, just have the information again. Like, I feel like there's so much that women don't know. Like we don't know
Mm.
what to expect. We don't know, you know, just kind of like find ourselves in menopause one. And then with all the like side effects, you were lucky. I didn't have, you know, my symptoms weren't as bad either. And considering that it's it's kind of surprising if I think about it, because I had endometriosis when I was younger, and I only have one ovary. So it's like really surprising that my menopause symptoms weren't as severe, you know. But yeah, I mean, again, like I think that you know, the education part is missing. You know, we just don't know. And then especially not only women, but the partners, like the husbands, the partners, the, you know, boyfriends, whatever, significant others. And like you were saying before, you know, this affects your personality can change completely. And this is going to affect your relationships, not only with your spouse, but with your kids as well. Like the whole family is going to be affected, right? So I think it's super important that people are more informed. So I want to thank you so much for your time. Sorry for all the technical problems and changing the platform of the interview, because I don't know what's going on with Facebook today, but it was just not our friend this morning when we were trying to connect. So I thank you so much for hanging in there with me and giving us your time. I know you're super busy. You're traveling, I think, this week and getting ready for your, you know, other things in your profession. So I really, really appreciate your time with us, Dr. Georgia. And
Thank you for having me, Patty.
yes, thank you so much. And if anybody has any questions about anything that we discuss here, please leave me a comment on Facebook, and I will be happy to come back and answer those questions and on anything that Dr. Georgia mentioned, and, you know, talk to her if I need to get more information from her, because I'm not an expert, she is, so that's why she's here. So thank you again for joining me, and you know, we will be, you know, chatting, I'm sure, on Facebook and, you know, other places. And thanks, Melissa and Patty, as well, for joining.
Have a beautiful afternoon. Thank you so much.
You too, Georgia. Bye.